Many of us have family members who were and are diagnosed with a debilitating medical illness. For those who haven't experienced seeing a loved one in pain, simply its imagination can conjure emotion. Organizations such as Death with Dignity have fought for the patient's right to assisted suicide. From a simple and logical point of view, why shouldn't this be enforced? If a family member or yourself ever want to end your life, shouldn't you have the option to do so? The answer, despite seeming straightforward, is in fact a slippery slope. Physician-assisted suicide, if legalized, would have vastly negative social implications that outweigh the benefits for the few. Physician-assisted suicide refers to the practice in which a physician provides a potentially lethal medication to a terminally ill, suffering patient at his or her request that can be taken or not at the time of his or her own choosing. Different from euthanasia, which involves a lethal drug administered by the doctor, a patient is prescribed medication that they must voluntarily take themselves. Currently in the United States, 5 states, California, Colorado, Oregon, Vermont, and Washington, have legalized physician-assisted suicide via legislation, in one state, Montana, via court ruling. And it is apparent that people have had trouble coming to a clear conclusion. In the states in which PAS was legalized, the majority won by a tiny margin. In Colorado, the yes vote percentage was 65%, Washington at 58%, and Oregon at 51%. It is clear that people are having a difficult time deciding whether PAS should be legalized or not. So, under what pretenses did these states come to their conclusion despite the country being overwhelmingly against its legalization? Activists who fight for the legislation of physician-assisted suicide often focus their argument on the idea of dying with dignity, emphasizing the relief of suffering, individual autonomy, and the patient's right to be free from paternalistic state intrusion. Being able to have control over your life, including its end, should be a right if living with a terminal or debilitating illness. PAS activists find the denial of a patient's wishes to suicide as a form of denying care. Emphasis is put on the idea of compassion and its practice being used only as a last resort method. In the states in which PAS is legalized, there are the following requirements to be eligible. The patient must be of legal age, making a voluntary request to a competent moderator, his or her physician, through a series of requests. The patient must also have a remaining month expectancy of 6 or less, and be mentally and physically capable of self-administering the drug. Activists of PAS emphasize the right of a patient's control over their life, and claim that its legalization will produce more good than harm. But is that really the case? PAS, despite its initial compassionate stance on the livelihoods of patients, in practice leaves too much room for abuse and leads to new and more complex social issues. At first, there seems to be little debate on whether physician-assisted suicide should be legal. The practice would involve a mentally and physically capable patient under the mediation of a competent specialist. Why should the practice be legalized to deny their right to this option? But we must remind ourselves that society puts many restrictions on liberty for a variety of reasons: to protect others, promote the common good, and to safeguard bases of moral law. Those against PAS's legalization emphasize its vulnerability to abuse. Firstly, PAS would threaten the weak and marginalized because of cultural pressures and economic incentives. Governor Mario Cuomo reported on an executive summary on the topic of PAS and euthanasia that the practice will pose the greatest risks to those who are poor, elderly, members of a minority group, or without access to good medical care. If one is given the option to deal with death in a cost-saving manner, those who are financially insecure or find themselves as a burden will be driven towards taking it. Secondly, our culture's familial obligations will be disrupted, as the temptation to view elderly or disabled family members as burdens will increase, as the temptation for those family members to internalize this attitude and view themselves as burdens increases. Our culture's intergenerational duty of caring for the sick and the elderly will be tainted with the desire, economically driven or not, to get rid of this responsibility. As those who are financially insecure, elderly, and disabled fall as victims, the legalization of PAS would be devaluing the lives of those groups, contradictory to every person's natural right to life. Can we ensure that physician-assisted suicide aligns with the core commitment in the practice of medicine? The practice of medicine is built upon the basis of healing. The Hippocratic Oath, historically taken by physicians, requires them to neither give deadly drug to anybody who asked for it, nor make a suggestion to this effect. Human life doesn't have to be intentionally terminated. Currently, doctors may help the patients die with dignity in ways that don't induce or suggest suicide. By allowing the patient to choose whether they want to cancel or deny medical treatment, whose successes seemed grim or unpromising, doctors can help patients die a dignified death. Medicine is governed by its core commitment to heal patients. PAS goes directly against that. And how can we ensure that this practice is not going to be abused? Already, there are suspicions surrounding the prescriptions of unnecessary drugs on the basis of profit. PAS will be a new incentive for insurance providers to abuse the financing of healthcare. With this being a worrying issue, the trust that patients place in their doctors will be seriously breached if patients fear that their doctors may encourage and actively facilitate their death. Taking a less paranoid view, inaccurate diagnoses are completely possible, and they happen. It is also often impossible to provide an accurate prognosis unless the patient is days or weeks from dying, and pathologists tell us that post-mortem, about 1 in 20 are found to have died from something different to the condition that they were being treated for. Pressures are ultimately what will fail this practice, and they are subtle. Pressures in the cost of care and life insurance about to expire, or the person who picks up on their family or care provider's stress and doesn't want to be a burden. These areas of abuse are far too welcoming. Instead of legalizing physician-assisted suicide, we should respond to such dire suffering with immediate aid, and aid can come in many forms. Typically, those who seek PAS suffer from debilitating mental illnesses, as well as simply from loneliness or hopelessness. Instead of reaffirming their beliefs, we should offer appropriate medical assistance, and most importantly, compassion. Those who seek PAS due to physical pain should be offered palliative medicine to relieve their symptoms the best that they can. For those whose death is imminent, or choose to refuse or end medical care, hospice care and family should accompany them through until the end. What we should focus on is how the best medical care can be provided for all. Since the law was passed in 1997, in Oregon, a total of 1,749 people have had prescriptions written under the Death with Dignity Act, and 1,127 patients have died from ingesting these medications. So, I ask of you to think about the remaining 622 people who chose not to go through with its ingestion, whether by personal choice or governed by nature, and the 1,127 deceased who don't even get the option to wish they had it.